What is this IV infusion therapy?
With IV infusion, that person will be able to achieve 100% bioavailability of that particular supplement.
So other than glutathione, what other substance do we use, and for what conditions do we use?
But just the glutathione is used for athletic performance and recovery. It is used for better cognitive function. It is used for liver, kidney detoxification.
As you said, it's also trending. So what I want to know is how safe is it?
The safety parameters and everything is all in the hand of the clinician, the physician, the practicing doctor.
How much research has been done in IV infusion?
Yet the research is to be done, a lot of clinical trials, clinical data.
Every wellness practitioner can use this therapy as a supportive therapy.
And within 5 minutes, the patient said that, oh, now I feel released. Now that headache has gone. Why? Because there was deficiency of electrolyte. So just basic electrolytes deficiencies can correct major indications also.
Doctor who has recently passed out, and if he has to set up a IV infusion clinic, so how much money does he have to spend to set up that?
IV, there's not a lot of investment. Did you know this?
I welcome everyone to a very special podcast. And this special podcast is going to be on a very interesting and trending topic. The topic is IV infusion therapy. And it wouldn't be wrong to say this IV infusion therapy booming in India is happening because of a very famous doctor, Dr. Prithvi. And we are very happy to have him. And he is a master in IV infusion therapy. He has been a pioneer in the subject and field. And we are very happy to have you here, sir.
So, sir, how are you?
So thank you for this lovely introduction. And I cannot call myself master because as a doctor, we always call ourselves like we are practicing. We are keeping on learning new things. So the state of mastery is not reached. We keep on practicing. And I'm still learning and looking at the trends, looking at the new things which are coming for our patients to benefit from. They are very amazing, and hopefully this podcast is also really going to be so interesting and insightful.
Yes, definitely, sir. So for the viewers, what is this IV infusion therapy?
So let's understand like on a very grassroots level. Now, when we talk about deficiencies, we've been learning about deficiencies since our childhood. Vitamin A deficiency, vitamin D deficiency, and then we need to supplement it with something. Or maybe the protein is less. You might have heard that for the gym goers, that if you want to build muscle, supplement it with protein or amino acid, BCAAs.
Creatine.
Most of the, yes, creatine, excellent, yeah. So all these are supplements which human beings need for performing their day-to-day activities for cellular health and otherwise. Now, you consuming it orally is one thing where the bioavailability is impacted drastically. Where you consume a tablet, where you consume a supplement, it goes in your stomach will destroy half of it. Then will go in your intestine and then via the hepatic portal vein into the liver, where it metabolizes and then goes into the systemic circulation, where only a fraction of that supplement is being benefited for that patient or that person who's taking the supplement. Now here comes the IV infusion and here comes the IV in picture, where whatever you want to supplement that person, that particular patient, or whatever deficiency he has, and you want to supplement it with IV infusion, that person will be able to achieve 100% bioavailability of that particular supplement, which drastically changes how we look at the wellness aspect. Now, when we talk about skin, we talk about hair, we talk about athletes, we talk about sports nutrition, and a vast variety of medical conditions also. Migraines, Alzheimer's, cancer for that matter of fact, with few wellness ingredients, with few nutrients, with few vitamins, with few antioxidants, 100% bioavailable straight to the source, we are literally changing the game of wellness in India with IV infusion.
So as you were telling, so 100% bioavailability and IV nutrition. What is it? What is the bioavailability in if you take as a tablet or orally? Or
So bioavailability, as in the name suggests, how much percent of the active ingredient is getting readily utilized by that person. Like for example, let's as we just discussed protein, let's discuss amino acids. Now, if someone is taking amino acids orally, the most common one which everyone might have heard is the branch chain amino acids,
Yes,
BCAAs.
yes.
So if you're taking that, near about 30-40% only is bioavailable. Did you know this?
So other part 60%, is it wasted?
Yes, because the stomach acid, the gastric acid, then it has to metabolize, then pass through the vein, and then goes into the systemic circulation. So this everything is bypassed. So you have amino acids, which is a underdog. There are essential and non-essential amino acids, and if you supplement with amino acids, lysine, tryptophan, threonine, this will not only regulate hormones, it will help in protein synthesis. And as we were discussing, like for example, BCAA, the entire aspect of recovery also becomes way faster and way better.
Yes. So why is there this something called oral thing? Because if IV is so much good, actually, because we are wasting 60% of this component.
So now when we talk about IV, it's not something which the person can do on his own. It requires guided medical expertise. It requires a good clinical setup and everything. Now, oral is a thing which, of course, is still needed. Post the IV for maintenance, post the IV is done. Post that, the oral supplements are going to be needed. And just not the oral supplements, for that matter of fact, even dietary supplementation is going to be needed. Proper nutrition, proper diet has to be supplemented. So it's going to be a balance of everything.
Yes.
But IV is going to be that boost where if a person is suffering, his sufferings or his conditions are going to get improved drastically in very less amount of time. And then, of course, then the oral supplementation, the nutrition, the diet aspects come in.
Okay. So this trend has been emerging. So what do you think is the cause of this? Did it emerge? Why did it happen?
So this always is a very interesting and fun question to address. If I have to be brutally honest, the reality is Indians are very aspirational. To be very honest, Indians will look at Americans, Indians will look at Koreans, they'll look at their skin and they'll be like, okay, I need this kind of skin. And what is the path to get there? And there's one very famous molecule, like how there's this slogan of this politics that Bharat ka bacha bacha. So it is that way only, where glutathione is known by almost all of Indian females and males also currently, where its proposed side effect of skin lightening and skin whitening was taken into consideration, and it was a boom. Of course, it's not just India, all over the world, all over the globe. Of course, this aspect has led to patient awareness and patients and people knowing about molecules like glutathione. And which brings me to also talk about how glutathione was first utilized. Now, glutathione has a very interesting component. It has the sulfhydryl group. It has the SH group. Okay, now this acts like a flypaper. It takes away all the toxins in the body. Thiol group is also integral part of glutathione. And do you all know where this thiol and SH group is found in which other drug?
No.
It's found in anti-cancer drugs. Mercaptopurine, sodium orthosilate. All these drugs have the same group which glutathione has. So what happened was that these scientists, these research people, they started utilizing glutathione for cancer patients. They were utilizing the glutathione on cancer patients. They found that the patients of cancer had an improved PASI score. PASI score is where we rate the skin on a lot of factors, and they had improved PASI score. The pigmentation was reduced, and they found this interesting side effect of glutathione, and from there it has just propelled into the globe for skin lightening, skin whitening. And that's where, of course, I feel that was the foundation for the world and Indians specifically to look into IV for a specific cause. But it has done good, because when they come in, we of course explain them a lot of things, and they do it for wellness, so they do get benefits of lots of other things along with the glutathione.
So other than glutathione, what other substance do we use, and for what conditions do we use?
So it's a very broad category, as we were just discussing about glutathione, where the antioxidant effect is looked into just for the skin. But just the glutathione is used for athletic performance and recovery. It is used for better cognitive function. It is used for liver, kidney detoxification. Now, glutathione is made in your liver and kidney beforehand only. And when you supplement, it enhances. Or when you age, it enhances. Now, this was glutathione. But then you have IV infusion for hair. You have IV infusion for detoxification. You have chelation IVs, where heavy toxic metals can be chelated from the body utilizing it. You have ozone IVs, which are very, very trending, where we infuse ozone in the whole blood and re-infuse it in the patients so that the patients can get benefit. Oncology is a separate sector where the IV infusion has found a lot of interest in, where the therapeutics are completely different. We'll probably get more onto that as the podcast goes. But so when we have these training for doctors, we teach them 30, 40 plus different medical conditions in which we can utilize. And very interesting ones where we've seen great results is sexual dysfunction, where the sexual function has improved, sperm motility has improved, egg quality for the females have improved, PCOS has improved, medical conditions have improved. So it's just the tip of the iceberg which the people look at. But beneath, there's a huge ice block which still needs to be explored.
As you were telling, Ki, there are so many multiple places where it can be used. So it is not restricted to a small niche, as you are saying. Aesthetic people could also use, from somewhere the gynecology people could also use. So it's a big platform.
Huge platform. And in fact, any specialty you think of, you have a particular use. Even ortho you think of, you have a particular use. And again, a very interesting use, if I have to tell you, are the hangover drips. Since we were talking about the use cases, where hangover drips are used pre-drinking, so the person can drink more. So there's a particular science to it. It's not anything, where the alcohol metabolizes faster when they do the hangover drips. And post-drinking also, to take care of all the symptoms of hangover, like headache, nausea, vomiting. So there's particular combinations which we use. And hangover drip bars, IV bars are also some things which again have been inspired, and probably locations like Goa and probably somewhere where the drinking culture is higher. There it can be used. Just an interesting twist of applications, and just not the serious ones.
As you've opened a galaxy of a lot of IV infusions, so the thing is, as you said, it's also trending. So what I want to know is, how safe is it?
That's a very interesting question. You were silent for so long waiting, but asking the right question straight away, right over there. So the safety parameters and everything is all in the hand of the clinician, the physician, the practicing doctor. Now, I'll tell you the sad reality about Indian doctors, and it is the sad reality. I cannot, and the people watching it, if they have to get offended, maybe let them get offended. But Indian doctors have a huge, huge ego, okay, where they feel that if they've read something, they've learned it, they don't need to learn more. Probably that's the end of it, or probably going to learn somewhere or to some place or to someone is going to probably have issues for their learning, and they would not want to learn, they would not want to invest in learning and upgrading and upskilling their knowledge, because of which there is a lack of knowledge in the doctors for utilizing these components. Basic, I'll tell you, even during my trainings I've seen super specialists don't know what is the difference between isotonic, hypertonic solutions. They don't know what concentrations have to be given for which patient. Randomly they are infusing the elements. Now, when there is randomness, when there is lack of knowledge, when there is darkness, the mishaps are bound to happen. The safety profile is bound to get slaughtered in the process. So, if I have to answer your question, the safety profile is all in the hands of the doctors. If he's learning the right dosage, if he's learning the right data, the drug interactions, what drug to infuse at what rate, what speed, that also matters. How much duration, when to repeat which dose, how to decide on what elements need to be infused for this patient. If all these parameters are taken into consideration, then there is a huge, huge safety profile with which the patient can comfortably, happily do his infusion, get the benefits, and go back home alive.
Correct. So another thing is, I would like to talk about the research aspect. How much research has been done in IV infusion?
So comparatively, it's a very new and upcoming field. So honestly speaking, there are a lot of clinical trials and data which still yet needs to be analyzed. Now, whatever I speak, whatever I talk with some backing in mind. I just hate talking arbitrary things. So to answer that question particularly, when we talk about IV infusions also, these are empirical therapies. By empirical therapies, we mean that these are not direct treatments which we are suggesting to the patients. These are supportive line of treatments. These are treatments which will help support his condition. Underlying cause for that condition, underlying cause for that indication has to still be figured out, has to still be treated upon, has to still be given the medications which that underlying cause needs to be given. So, yet the research is to be done. A lot of clinical trials, clinical data needs to be come in. And I think the doctors who are involved will realize that a lot of elements here are micronutrients, are vitamins, are antioxidants. That is what they're going to deal with. So it is going to be definitely safe, but they need to remember that these need to be considered as the supportive line of therapy and not the primary line of therapy, irrespective of the condition.
So as you were telling, it should be a supportive thing. So every wellness practitioner can use this therapy as a supportive therapy to increase their results and the speed of.
Perfectly, yes, you've gotten it exactly where I want to go. Say for example, a migraine patient. Migraine patient's underlying cause can be anything, but just few deficiencies, and these are real cases what I'm discussing, where just deficiency of magnesium and electrolytes. Okay, electrolytes also extremely essential so that the headaches are lowered, the pain is lowered, and the recurrence of the headaches are lower. So in migraines, supplementing with electrolytes. Do you understand how basic electrolytes are? And if you go on the IV aspect, and if you supplement, just forget the elements for now. Just electrolyte supplementation. Sodium chloride, 0.9% sodium chloride. Just that was supplement. And this is an example in my clinic only. Patient was having an episode of migraine where that headache was there, and he did complain that he was having some right-sided headache, and we just started the IV. We, of course, we were wanting to infuse other elements, but we just started the IV, and within 5 minutes the patient said that, oh, now I feel released, now that headache has gone. Why? Because there was deficiency of electrolyte. So just basic electrolytes deficiencies can correct major indications also. But here, are we solving the migraine? No, we are helping.
Yes.
We are supplementing. That is how the wellness integration comes into picture.
I would like to talk about the healing time once the IV infusion is given to a particular patient. So how much time does it take, or how much time does it take for him to come back to normal?
So here it depends on the indication. Personally, every indication will have a separate time duration for recall of the patient, where sometimes we call twice a week, sometimes we call once in 15 days, sometimes we call once in a month. So it depends on the indication, and the recovery is also planned accordingly on how severe the indication is, how much supplementation we need to give. But though on an average, if you have to ask me, a 6 months therapy is what we plan, and then we give like a gap of 2 to 3 months so the body can also process its own thing, and then we can redo it again. And depending on the indication, the recall of the patient is decided.
So a standard treatment takes 6 months, or is it a smaller version also?
So it is to do with any supplementation. Even if you're taking oral supplementation, even if you're taking a multivitamin tablet, it is not suggested that you take any multivitamin also for more than 6 months. Okay, because there are chances of toxicity. If you're taking specifically any hormone-based or supplements, so your own hormones are impacted. Like, just to give you a context, if a person is taking testosterone to boost his muscle mass and boost everything, body's own natural testosterone production is impacted. And there's a similar concept is here also. We give like a 6 months therapy for that reason only. Then we give like a break to the patient, and then we can restart. Also, at the same time, where you look at the levels, you do blood investigations, and then we can redecide and reformulate the therapy for the patient.
The trending drug, the Ozempic one, so does that also come under the IV infusion therapy?
Okay. So people are going crazy for Ozempic.
Yeah.
And we've been seeing celebrities. That is another thing. We've been seeing Karan Johar, we've been seeing Badshah,
Yes.
we've been seeing Kusha Kapila, all these famous celebrities who are coming in front, and there's a transition in 1-2 months, and the person is looking slimmed out, and the person has transformed completely, and now everything has changed for that person. So Ozempic does not fall under IV. It is a GLP-1 agonist, and it is a subcutaneous injection, which is complemented along with the IV. Now, weight loss IVs are a thing where we use concoctions so that the fatty acids are utilized for energy, along with which the subcutaneous injections like the Ozempic, which is semaglutide, are injected. Wegovy, Manjaro, these are few other examples of GLP-1 agonist which help with the diabetic and weight loss control as well. But these are separate, completely separate category of peptides. And peptides are a different world of treatments where the future is going to. In fact, I'm very intrigued where the medicine and the future of medicine is going to. As we were discussing peptides like Ozempic for weight loss, there are peptides for muscle bone recovery. There are peptides for quick fat loss. There are peptides for better skin. So that's where the injectables and the future of medicine is going. And wellness, the future is really, really bright for the Indians and the doctors. Red light therapy, cryotherapy, hyperbaric oxygen therapy, all these wellness treatments are taking over, and the benefit is going to be for the end user, that is us only, of course, at the end.
So moving on, who is eligible to practice IV infusion?
Okay. So any graduate doctor who knows, I always tell this to all of my doctors who come to learn or come to train, that ask yourself that do you know what you're doing? Even after learning, do you know, have you gained the complete knowledge of what you're doing? If the answer is yes, only then you go ahead and start of thinking that you're going to venture into this particular field. Now, for this particular example, I always give an example of COVID. During the COVID, what had happened in India was the Indian healthcare system had literally crashed. There were patients, there was a huge demand of doctors, and there were nurses, there were non-medicos doing the roles of the doctors. We are so much lacking behind in healthcare, and yet the access to knowledge, the access to skills which a doctor should have aren't easily available. So it's a life-saving skill. Forget the wellness aspect. It's a life-saving skill. Lives can be saved if he's a qualified medical professional, if he's a graduate. He knows his way around for IVs. Even in such drastic situations, their help could be taken and lives could be saved. So, of course, the doctors need to ask themselves that do they know what they're doing? If the answer comes as yes, if the registered medical professional has that answer as yes, then there are so many things which could be further discussed on how the setup could be done, how he could start a center, what requirements, what medical legal aspects need to be looked into, which of course need to be looked into. And there's so many and so on. But the first stepping stone is getting the right knowledge from the right person, from the right source. And that's where the things start transitioning.
Correct. So as you spoke about venture, so now the main thing is usually what people run behind. So I'll come back to that topic, that is money. So if a person has to set up a clinic, like a doctor who has recently passed out, and if he has to set up a IV infusion clinic, so how much money does he have to spend to set up that?
Okay. So as we just discussed, first thing is investing in his own knowledge. So first thing, if he needs to spend, is to spend on the knowledge and acquiring the knowledge. Once that is achieved, then he can start off thinking of venturing out and starting his own business. Now, when we talk about IV, there's not a lot of investment which is needed. It's more of the product which he needs to buy and infuse in the patient. So the investment is barely around 1 to 5 lakh. If he's a very much a beginner person and wants to start at a very small scale. And if you talk about the returns, now we have all of the audience looking at us. We have doctors, we have patients, and everyone. So a single IV infusion ranges from around 2,000 to 5,000, a single IV infusion, which is what I'm talking about. And then there are few newer components like the NAD, if you will have heard about NAD, NAD plus IVs, where they even charge around 50,000 for one single IV infusion. So the recovery of whatever they are trying to invest is very quick if they are having the right knowledge and they build their own practice, and then the word of mouth happens. That is how the medical practice always has been. If you're doing the right thing, if you're giving the benefit to the patient will spread his word of mouth, and the word of mouth spreads, your practice grows and everything grows. And of course then there's a lot of money where the doctor can.
How big is the IV infusion market in India?
It is rapidly expanding. Trust me, it is rapidly infusing. Cannot put a cap to that number because people are practicing integrative,
Yes.
where the homeopaths are integrating homeopathy, the Ayurvedic doctors are integrating Ayurvedic practice, where the naturopath are utilizing their naturopathic practice, integrating that to their practice. So there's a lot of integration, and irrespective, even specialists, I've seen oncologists utilize the IV infusion as a separate treatment room in their oncology center. I've seen gynecologists use separate IV infusion and aesthetic aspects in their gynecology center. Now, whenever there is integration of a lot of fields, you cannot put a cap, but trust me, the number is so huge that everyone can get their good piece of cake.
And this is going to grow, right? With the
It
coming.
is growing. It is growing, and the time duration in which rapidly the new treatments are coming down, the wellness aspect specifically, and if the doctors are integrating that as well along with the IV, again it takes the treatments to a whole different ball game.
How aware are the patients regarding this IV infusion? Are they aware?
Oh, very aware. Like, we've still not discussed any case histories, but I'll tell you, I see patients like who are 16, 17, and they want to get the IV infusion treatments done because they are, again, very aspirational. They are looking at people getting it done. They're looking at their favorite celebrities getting it done, and they are endorsing it also. Like, I'm very happy that Hrithik Roshan, a big name himself, where he's considered the Greek god and he's considered, the best in the industry for his body. So even a person like him is endorsing IV infusion therapies for wellness, for recovery. So that definitely makes a big change in the patient. When the patient are definitely aware, once the clinician also comes in, once the doctor also comes in, he utilizes his expertise to the patient. Everything mutually is agreed upon, and the patient is also readily doing the IV infusion therapy without any fear or scare in their mind.
As you spoke about the case histories, so this is just I want to ask you, in your entire experience into this, so which is the most interesting case which you've solved by IV?
There are many
One
interesting,
which you
many
find-
interesting. In fact, I cannot stop at one because
Which has happened and no one was expecting something.
so there are multiple. I'll give you 2, 3. So in my family only, there was a female who utilized steroids for a long time for her pigmentation, and she was so depressed, so traumatized that she just stopped utilizing it, and the pigmentation had completely taken over her face, and she stopped going outside. She had lost motivation. So when she reached out to us, we did say that yes, let's go on and try on few elements which will help with the pigmentation. It did take some time, 3 to 4 months, and drastic change. And she always tells us that because I can go out because of you. And one very interesting case was where we utilized the potential of exosomes, which is again future of medicine, and IV therapy. And it was for hair regrowth. And this was, by the way, a 22 years boy. And this particular case is also very close to my heart because we've done his treatments. Everyone said that hair transplant is the only thing for him, but his donor area also was very, very weak. So we utilized the power of diagnostics. We saw that his testosterone levels were high, worked on that, started on IV infusion, and he got a very good hair growth. And why it is close to my heart is because that patient said that he was planning on suicide because of his colleagues who were, making fun of him, mocking him. And such aspects really touch your heart, and then you realize that this is what you've become a doctor for. And then again, about NAD, if I have to talk, very recent case, it was 60 years old male where we'd given NAD, and two miracle things happened for him. One was his eyesight improved. Second, the patient, again, because NAD is a new molecule, so we cannot claim on a lot of things, but the patient reported that he has improved sexual function post NAD. And for him, it was the best gift which a IV infusion could give. So there are so many miracles and stories about weight loss and others. So probably we'd need a different podcast for it separately.
So as this is a growing trend, so if anyone masters this skill, so in next 5 years where the boom is going to come more, so he would dominate the market is what you will say. And that's why it's a very need of the hour skill to learn this. Don't you think?
Correct. So always, I will always believe the money has to be secondary. If you're even thinking of, if you're looking at this podcast and thinking, okay, I'll join, I'll enroll, and then the next moment I'm in yachts, I'm in hills, and I'm in private jets, then that's a very wrong approach. As a doctor, first, the patient has to always be first. His disease, his condition, his indications have to be first priority solved, and then everything follows.
So what kind of doctors do you train? From where are they coming from? All over the India?
All over the world. We've seen people even from Africa come to us and train, which is again very interesting. That means look at the demand for knowledge. That person takes a flight all the way from Africa and comes and learns. And of course, then we have all kind of specialties coming, super specialties. We've seen neurosurgeons come in, oncologists come in, gynecologists. So we've seen all kind of, and even the other faculties of Indian medicine, Ayush doctors come in. So all of these doctors is what we cater to, and they are very happy, and even the patients are very happy.
So how long does your training happen for? The duration of that?
The specific IV one
Yes,
which you're
yes.
talking about? So it's 1 to 2 days is what we usually do. So person is aware about IV, basic things he knows. 1 day is all he's going to take to learn, but it's going to take forever for him to master.
Yes.
Okay. So we set this foundation. We set the foundation for the doctor to, lay his brick on, and then he has to take it from there. And we are always there to help them, to guide them. There's a community of doctors which we have built over a period of time who will help them. And we have live lectures, we have support which is needed when the patient is there and the doctor is in need of some solution and is stuck. So, at such places, if there is a support system, then it definitely pushes the doctor to take that extra mile of effort for his patient.
So usually this Ayush doctors don't have much practice with the IV infusions and anything. So is it okay for them to come directly join your course or join your training, because they are a little bit lacking behind than other Ayush medicine doctors, because they keep using the IV system?
Correct. So if any doctor at any particular time feels that he is lacking somewhere, he needs to take action. If he is not taking action, he is going to be at the same place where he is. And in this ever-evolving field where every day there is a new thing which is coming up, every day there is a new advancement, if you fail to upgrade yourself, when you understand yourself that you are lacking, you are going to be left out, you're going to be left behind. So that's the first thing which they have to do. Actually, surprisingly, registered nurses and phlebotomists have the medical legal authority to do the phlebotomy, do the IV infusion under, of course, the doctor supervision.
Yes.
So if the Ayush doctors also take it upon themselves to make this field much more better for themselves, and that's going to happen. It's not that difficult at all.
So this was about the IV infusion thing. What about the peptides and the Ozempic ones? How do you train doctors in that? Is it offline, online? How?
So we usually have a dual mode of training. We understand the doctors have their busy schedules. They have their own OPDs. They have families to look after. So some of our trainings and programs are online, which is very well preferred by the doctors. So like the peptide one is what we do usually online because it is a subcutaneous injection which it's not more of practical learning which they need to. It's more of a theoretical understanding of the subject on how the peptide is working, how it is like how the GLP-1 agonist is working, and so on and so forth. And the ones which require hand skills, which require your skills, like injectables or specifically say Botox or fillers or threads. So these particular training needs to be there offline. So even IV, we prefer it offline because it gives you a real-time understanding even for emergency situation. Where in one of our trainings, a patient developed an allergic reaction to magnesium, and it was a real-time scenario. And of course, I was present there. I was monitoring. I was looking at the situation. And I was just waiting for the doctors also to respond. And I was checking on how they would respond and what has to be done. That gives them a very good perspective on real-life emergency situation, how to deal with it. Once they are in the battlefield, only then they would know how to fight a war. If they're sitting at one place and just viewing it, it's a different experience altogether. So for such trainings, I humbly request doctors to come down and train and experience with other doctors as well, because it's a group effort.
Yes.
And like how this podcast is going, whenever it's my lecture or whenever it's my theory, it is very, very interactive, and the discussions are there where we discuss with doctors. There are topics and tangents which go to deviate to a different subject, and even that discussion is so strong and so scientific that everyone enjoys it. And it's a different thing which happens only and only in the offline trainings. So offline trainings, I love offline trainings any day more than online trainings. But yes, for the people who cannot afford time and the schedule are busy, there are few online courses also which they could avail.
Mhm. So for the offline IV infusion course, what are the key topics or subjects which they are going to learn if someone enrolls?
So my core specialty is taking new advancements in the field and imparting it on the doctors. Now there's a very good diagnostics tool called OligoScan, which is recently found, where it works on the principle of spectrometry, and they can see all their micronutrient deficiencies without the need of giving any blood. So that is something which we have started training our doctors. So anything new which comes in, we try to integrate in our course. And usually there's a wide variety of indications which we deal with, like 30 plus indications, 30 plus ingredients, when to use what is the difference between lookalike, soundalike, like magnesium sulfate, magnesium chloride, which one do we use, which one when not to use, how to inject in intramuscular, subcutaneous, intradermal, how to integrate with other therapies. So even though it's a one-day thing, it's like a bonanza of knowledge which they get into. And most of the doctors post the theory and practical, they come and tell me, doctor, अभी मुझे ही IV लगाना है, इतना हो गया है knowledge. Because it is that intense, and we keep on going on, throwing new topics and subjects. So it does get a little overwhelming at times. But if the person is with a stable mind, understanding, processing it, he can go back home, read more about it, and that time he will understand it better.
Talking about the market, what I want to know is there are how many IVs available in the market?
So there are plenty. Skinny drip, hair drip, athletic performance and recovery, weight loss drip, detox drip, hangover drip. So there are plenty drips, and everyone has customized the name of the drip according to their requirement. So anyone can name it as per their requirement. So there are plenty IVs. The elements though are restricted. There are 30-40 elements which are the core crux of the IV infusion therapy. And these elements, like just because the elements had come up, these IV infusion is not something very, very new. It's been happening since 1960. And John Mayer was the first one to introduce Mayer's cocktail, where it was a combination of multiple elements together: magnesium, calcium, vitamin B, and it's used for multiple indications. So from there, the infusion has getting upgraded, where multiple vitamins, multiple nutrients aspects are infused in one single IV and given to the patient.
As you've gone back to the history, so I just want to know who's the father of IV infusion.
John Mayer is considered. And since you spoke about history, I'll tell you one thing. Very early in the days, what happened was there was a blood transfusion between sheep and a human. That means the sheep's blood was transfused in the human. And do you know what was the fate of that? Death. And do you know today, when such things happen, the fate is death. You know what is one common link between that story and today's story, which the mishaps are happening? The common link is lack of knowledge. So again and again, we come to this wonderful aspect of enlightening yourself as a doctor, as a clinical physician, with knowledge whenever and wherever possible.
So I wanted to know the best brand if a doctor wants to buy a IV infusion, like a drip. So which is the best brand he should choose?
So rather than looking at the brand, you should look at the authenticity of the company, where it is manufactured, because there are tons of brands. It has to be a WHO GMP certified manufacturing facility. The certificate of analysis should be given by the company towards you. What is the percentage of that particular element? Where has the raw material being acquired from? All these questions have to be asked from where you are sourcing it from. All these matters. So I cannot name any particular brand per se on this podcast, but yes, when they do come for the trainings, we do showcase few brands to them. They understand it. Even these people come to meet the doctors. So there's this bond between these people, the pharma companies and the doctors. And that relation is also very sacred, I believe, because without the pharma people, the doctors are handicapped. So it has to be a very huge synergy between the doctors, the pharma companies, and there has to be a nice transparency between both. Only then it will lead to a better patient outcome.
So that's why you're telling ki a proper training is definitely required. And we and you are in collaboration organizing a lot of courses in upcoming time. And the next, we are having it in major cities. Tell which of these.
Yeah, so we are coming to Hyderabad. We are coming to Pune. We are coming to Delhi. We are coming to Gujarat. That is.
So I'm very happy that brilliant young minds like y'all I could associate with and ignite the light of knowledge in such areas where it is required and authentic knowledge. So when they come, till the time they start hearing the lecture, they are in thought process that is this going to be worth it? Is this not? What am I going to learn? Will I able to do justice to how much I've paid? What is going to happen? But once the experience is done, once the theory is done, once the practical is done, there's this huge smile on the doctor's face that whatever they have thought of, whatever they have expected, the expectation has reached beyond it. That's what we've found the testimonials to be. And that's what happens. Now, even when you're listening to the podcast, you understand what is genuine and you understand what is fake. You cannot judge a person just by looking at it. Once you see him talking, once you understand what level and depths he's talking at, the experience and everything, the perspective and everything changes.
So we both share the same vision, your company and our company. The vision is?
So the vision is to upskill doctors. So it is not only for the certificates this thing sake. We want to upskill, and each and every medical healthcare professional should get the right knowledge. And that's where we've collaborated with Dr. Prithvi Vaiti. Thank you, sir, very much for coming here to Bangalore, and see you again in another cities. Thank you.
Thank you so much.
Thank you. It was a pleasure. And Mac International also, along with me, has exact same goal where we want to change the landscape of postgraduate medical education in India. And hopefully with this collaboration, that happens and the doctors and the patients benefit out of it both. Looking forward for more such podcasts and more such interesting times. And the doctors, please come and enlighten yourself, and see you in the nearest city where we are going to keep our next training.
Okay. Thank you so much.